Well, hello everyone. Welcome to the We're Not Stumped podcast. I'm your host, Mike Boland, and today is April 24th, Thursday, April 24th. So you know what that means. It's news and notes time. So we're going to have fun today. I'm really looking forward to today's episode, but I want to talk about the two previous episodes on the last two Thursdays, because both of those, I had a lot of great responses on. 2 weeks ago, I talked about limb loss and limb difference awareness month and how I think it should be every day of the year, not just for the month. A lot of reasons why I said that. Go back a couple weeks and listen to that podcast episode. Last week, I talked about bullying with this person. I think they're out of Australia. I think I mistakenly said that they were out of the UK on the podcast, making fun of people exactly like me. And my thought is, I don't care what she says. I don't even know where she was from. So I really don't care what people think of me for having one hand. So go back if you have a second and listen to both those podcasts because, like I said, a lot of good responses. So thank you for everyone who took the time to reach out and tell me how much they appreciated both of those episodes. So this week, first of all, since it is Thursday the 24th, I am going to be recording it a little sooner because I am on my way, as this is coming out right now, I'm on my way to Colorado for the Limb Preservation Foundation annual symposium. I can't wait to go to that. I'm really looking forward to it. I'm going to be a moderator and I'm going to meet a lot of great people there. So if you happen to be there, this Friday is when it actually starts. I'm leaving Thursday, but if you happen to be there Friday in Colorado, please look me up. I'd love to see you. One last thing before we get into the headline that I found this week, which I thought was very interesting. Please like, share, and subscribe. It really helps the algorithms, right? So there's some people out there that need to hear the stories that have been shared on the We're Not Stumped podcast. Not necessarily just from me. All the great people that have been on this podcast, lower limb amputees, upper limb amputees, quad amputees, and the general disabled community. There's been a great cross-section of people on this podcast that tell you their real story. And they do it because they care and they want to see you get better. So if you're out there questioning where you're going and maybe some of your mental health, listen to some of the podcasts that have already been out on the We're Not Stumped podcast. You can find some that probably fit your exact, or certainly within a close proximity what you're going through, and you're going to find people that have been through it and got to the other side and now are extremely happy. So with that, let's get right to the headline for this week. And I found a really interesting one. This one comes from OSF, and it just so happens a little over a month ago, I had a couple patients, I had one patient and a therapist. Thank you. That's a very difficult word. I had them on about a month ago on March 18th. It was Linda Moore and Deidre Murphy. Pardon me. Linda Moore lost her, I believe it was the left leg below the knee. She's you want to hear a positive person and positive perspective. Listen to that episode. It was fantastic. And both of them together, to have both the patient and the therapist on, it was just a very interesting episode. And again, I want to thank Tim Dittman for getting me to meet those two. Fantastic episode. This particular headline comes from them as well. I just was looking at the internet, looking for some interesting things to talk about today. And this one really piqued my interest. And here's the headline. OSF Healthcare Innovator of the Year gives new hope to people facing amputation. So I think that's a great thing if you think about it. I live with limb loss, but gosh, if it's preventable, that would be a great thing. So this one comes not from Tim in particular. This one must come from one of his colleagues, Colleen Reynolds, out of OSF. And this was in April, just recently, at Peoria, Illinois. So here's how the story goes. I'm going to have some excerpts from the actual event. I'm going to have an excerpt from Dr. Eric Martin and others. So stay tuned for that. Here's the story. Eric Martin, DO, Chief of Vascular Surgery at OSF Healthcare, St. Francis Medical Center in Peoria, Illinois, has received the OSF Healthcare 2025 Innovator of the Year Award. Dr. Martin is preventing amputations using regenerative reconstruction, a groundbreaking approach that promotes healing and tissue regeneration through advanced therapies, including products made up of animal tissue and human tissue. This includes fish skin, pig intestines, pig bladder, cow tendon, and tissues from human umbilical cords that came from women who have planned elective C-sections. Dr. Martin received the award during an OSF Innovation Showcase at Jump Training, Simulation, and Education Center. The Innovation of the Year Award is an annual honor that recognizes individuals who are advancing their vision of transforming healthcare. Becky Buchan, and I hope I'm saying that correct, I did look it up. Becky Buchan, Senior Vice President of Innovation, had this to say about Dr. Martin.
He shared cases to actually show us where limbs would have been lost in the past. And with his regenerative reconstruction and really kind of using and leveraging that novel approach, how he was able to save so many limbs. It truly was amazing, but also his compassion around that and the emotion with which he brought that forward, knowing that the course for some of those patients would have been very different.
Thank you for that, Becky. During 22 years in the U.S. Army, Dr. Martin spent time at Eisenhower Army Medical Center in Augusta, Georgia, a partner of Veterans Administration. While there, he treated many veterans with tissue damage, gangrene, or non-healing wounds from multi-level chronic peripheral artery disease. So he became immersed in vascular reconstruction as well as the reconstruction of lower extremities for limb salvage. In accepting the award, Dr. Martin emphasized that he's thrilled to be part of a source of hope for people. And here's what Dr. Martin said. I feel fortunate to be at OSF Healthcare, which has invested a lot of time and resources to build up the most advanced regenerative reconstructive practice in the state of Illinois, to serve as a destination center and a referral center for cases that other health systems don't want to take. Dr. Martin said, we can offer hope to people who have run out of hope. That's an end quote. Dr. Martin points out OSF Healthcare is taking on patients with the worst medical conditions, including heart, kidney, liver, and lung failure, plus complex peripheral artery disease and poorly controlled diabetes, which results in patients coming to OSF in septic shock, near death, and with a massively infected chronic wound. And here's another quote from Dr. Martin. We try to save their life, and we've been pretty successful at doing that. He also talked about the robust infrastructure at OSF during his acceptance speech, and here's an excerpt of Dr. Martin accepting his award.
The reality is that OSF has a very, very robust infrastructure. We have tremendous inpatient wound care nurses that help with all the patients that I take care of. We have an extremely robust outpatient wound care center that helps with my patients as well. And it's a collaborative team effort that has made this program so successful.
Well, Dr. Martin, congratulations on everything you're doing. Keep doing what you're doing. It's great that you're preventing amputations, and it's great that you won the award this year. Again, congratulations. Well, that's it for this week of the We're Not Stumped podcast. I'm your host, Mike Boland. Again, if you happen to be in Colorado Thursday and Friday at the Limb Preservation Foundation Symposium, please look me up. I'd love to see you. But as I say every week, everyone, have a great week.